Vertebral compression fractures, vertebroplasty versus placebo. Vertebral compression fractures are a cause of spinal pain and disability, either related to osteoporosis or post-trauma. Vertebroplasty is a simple spinal procedure in which bone cement is injected through a small hole in the skin into a fractured vertebra to try to relieve pain caused by vertebral compression fractures. Vertebroplasty is typically performed by a spine surgeon or interventional radiologist. It's a minimally invasive day procedure using local anesthesia and light sedation. During the procedure, bone cement is injected with a biopsy needle into the collapsed or fractured vertebrae. The needle is placed with fluoroscopic X-ray guidance. The special cement quickly hardens and forms a support structure within the vertebrae that provides stabilization and strength. Past RCTs have supported the efficacies of vertebroplasty in pain relief. However, the studies were only compared to a control group and not a placebo group. This study reviewed 6 RCTs on the efficacy of vertebroplasty for symptomatic vertebral compression fractures when compared to placebo surgery. They consistently found no significant differences between sham or placebo surgery and vertebroplasty. Based on a 2018 Cochrane review, vertebroplasty has not been found to be effective in treating osteoporosis-related compression fractures of the spine. When patients in both the vertebroplasty and placebo groups report equal improvements in their pain, it's suggesting that the potential benefits of vertebroplasty may primarily be the placebo effect. Despite the evidence, some vertebroplasty practitioners and organizations continue to advocate for the procedure. In 2010, the Board of Directors of the American Academy of Orthopedic Surgeons released a statement recommending strongly against use of vertebroplasty for osteoporotic spinal compression fractures, while in Australian, vertebroplasty is still considered for those who have failed to improve after a trial of conservative treatment, with conservative treatment being analgesics, which is effective in 2/3 of people. Instead of abandoning the procedure, some surgeons ironically are doing more levels as they assume that would be even more effective. In the United States, Medicare in 2011 spent about $1 billion on vertebroplasty and kyphoplasty procedures. Are there risks to vertebroplasty? Severe complications are extremely rare, but include infection, bleeding, numbness, tingling, headache, and paralysis related to spinal cord injury in 0.6 per 1,000. Here's a crazy idea. After a vertebral compression fracture, once the acute phase has settled down, how about some physiotherapy interventions to reduce fear of activity and promote loading exercises? After all, there are hundreds of studies supporting